Hi, it's Dr. David Greene, founder and CEO of R3 Stem Cell International. Today we're discussing stem cell therapy for diabetes in the Philippines. So there are two main types of diabetes. Type 1, which is where your immune system attacks and destroys your insulin-producing cells in the pancreas. Now, this is typically due to a genetic issue plus an environmental issue. There's actually quite a bit we don't understand about what causes type 1 diabetes. Type 2 is much more common and occurs usually later in life due to increased weight, lack of activity. There's a genetic component. Certain ethnicities have higher incidence of diabetes. Age can be a factor, high blood pressure, and high cholesterol. So unfortunately, diabetes is popular all over the world, and that includes the Philippines, where it's the sixth leading cause of death. 7 million Filipinos have diabetes. Worldwide, it's over 400 million cases. And in addition to the 7 million, 35% of Filipinos have what's called prediabetes, which is where there's a chronic higher than normal blood sugar, which may not be clinically relevant at the moment, but most likely it's going to be in the individual's future. So what are the complications of diabetes? Well, a lot of people don't know just how insane the complications can be. It can cause problems with the heart, diabetic neuropathy, which is where you have nerves dying in the legs and arms and the hands. You can have a lot of pain and lack of sensation. Kidney damage is unfortunately one of the worst complications of diabetes. It can cause issues in the eyes, the feet, the skin. It can impair hearing and lead to Alzheimer's and or depression. So let's look at conventional treatment options before we delve into stem cell therapy. The goal of all these treatments is to control blood sugars and to prevent the future complications I mentioned on the last slide. Type 1 diabetes is typically managed with insulin as well as diet changes and exercise. Type 2 diabetes can be managed with non-insulin medications or insulin, reducing weight, dietary changes, stopping smoking, things like that. At the last check, I saw there were at least 10 different classes of diabetes medications, and more come out frequently in these categories. So when we look at stem cell therapy for diabetes, it really is a new paradigm in medicine, where it's a non-operative treatment that can actually repair and regenerate damaged tissue, which is very different than what all those 10 categories of medications I mentioned do. They don't do any of this. This can provide relief and improve function. It's low risk, it's outpatient, effective. Not only can it help improve the tissue's function, it helps prevent the secondary complications. Our protocol includes a combination of intravenous and possibly some focal injections. We don't have to inject directly into the pancreas. That adds risk, and we do it very safely. And believe me, the stem cells go where they need to go. The pancreas is inflamed due to the disease. That's what attracts the stem cells. So how exactly do the stem cell biologics work? Well, there's a lot that we don't know specifically about how they work, but we do know a lot of the functions that they have or that they perform for other cells. A lot of it is through paracrine signaling, which is cell-to-cell interactions. This can induce recruitment of other cells, new blood flow, which is called neovascularization, and reduce cell death. So the cells in the pancreas that we want to continue performing their job, we can prevent them from dying and help them to live longer. I mentioned neovascularization, which is new blood flow. Immunomodulation, I put that in bold because that is the most important function in diabetes. Diabetes is an autoimmune condition. The body is mistakenly destroying its own pancreas. We don't exactly know why, but we know that with immunomodulation, you can stop that from occurring. There are some direct mechanisms that we don't exactly understand how stem cells work. All right, so let's go through some studies. Here's one from 2016, Clinical Effectiveness of Stem Cell Therapy for Diabetes. A meta-analysis is a review of a bunch of studies put together. So this was 22 studies, over 500 patients. Infusion of umbilical cord mesenchymal stem cells, which is exactly what we use in treatments, provided significantly beneficial outcome in type 1 diabetes when compared to bone marrow mesenchymal stem cells. The administration of stem cell therapy early after diabetes diagnosis was more effective than later stages, and it represents a safe and effective treatment for patients with diabetes. Here's a study just a few years ago, mesenchymal stem cells as a new therapeutic approach for diabetes and pancreas disorders. So not just for diabetes, but pancreatitis as well. So the immunomodulatory action of mesenchymal stem cells, which can reduce this immune system activation, could stop the production of self-antibodies against pancreatic beta cells, thus, blocking their degeneration and the progression of diabetes. It's a very promising strategy for the treatment of the three main pancreatic disorders as well: diabetes, pancreatitis, and pancreatic cancer. Due to their immunomodulatory and pro-survival properties, MSCs should be used to prevent disease onset or as a cure to protect pancreatic tissue. All right, stem cell secretome is a new booster for regenerative medicine. The secretome of a stem cell is the proteins that it secretes. It's all of them put together. It's a cell-free way for regenerative medicine therapies. It's shown great potential in a variety of clinical applications, including preventing the cardiac secondary disease, the neurodegenerative disease, type 1 diabetes, hair loss, tumors, arthritis. We use the stem cell secretome in conjunction with the actual stem cells, so we use them together to help with patients' diabetes. So long-term effect and safety of Wharton's jelly-derived mesenchymal stem cells on type 2 diabetes. These are exactly the stem cells we use, though it come from the umbilical cord, the Wharton's jelly, which is the inner part of the umbilical cord. So this MSC-treated group underwent 2 IV infusions with mean cell counts of 26 million stem cells separated a month apart. So they looked at postprandial glucose, hemoglobin A1C. They measured lower in experimental group up to 2 years. The insulin usage and the fasting C-peptide were significantly improved, and the conclusion is that the transplant of umbilical cord mesenchymal stem cells is both feasible and safe and effective. This is exactly what we use. Amniotic stem cell transplantation for type 2 diabetes. So this was very small. They had 4 patients. The glycemic control was improved dramatically. And this was a nice trend towards showing effectiveness. Amniotic stem cells are part of the postnatal tissue. We use those in our products as well. So when you look at many small studies and these early clinical trials, more of which are coming out every few months, and our own experience with hundreds of patients show that stem cell therapy for diabetes is not only safe, but it's typically very effective. So the key points is that high stem cell numbers are necessary. Most stem cell clinics around the world do not offer high stem cell numbers, or if they do, it's ridiculously expensive. We offer both high stem cell numbers for a very cost-effective treatment plan. The combo is what we've seen to work best, with stem cells plus stem cell exosomes delivered intravenously and possibly via an injection, depending on what the patient's symptoms are. Umbilical cord mesenchymal stem cells give fantastic results. That's what we use. Here I wanted to mention that we don't use embryonic stem cells. Those are the ones that come from aborted fetuses. Those are dangerous. They can be rejected right away. They can cause tumors. So we've never used those. We've never used induced pluripotent stem cells either. Neither of those are ready for prime time. So if anyone suggests that you should get an embryonic stem cell treatment, run away. So our international treatment program in the Philippines, our office is in Manila. The process starts with a free phone consultation with our licensed, experienced stem cell doctor. Our patient concierge rep will assist with all the travel logistics. If you're coming from out of the country, we'll pick you up from the airport, take you to the hotel and the clinic and back. We won't have to worry about any of that. If you're local, then you can just drive into the clinic. No worries. Now about the cells. Our umbilical cord stem cell tissue comes from the United States. It's very safe. It's FDA quality standards. we exceed those. Our pristine safety record has been for over a decade now. We've never had a significant adverse event. We've had a very only mild to moderate complications or adverse effects, which could be low-grade fever, some chills, some nausea, vomiting, nothing that would put a person into the hospital, so to speak. These are very pure and potent stem cells and growth factors, exosome, cytokines. It's a virtual orchestra of regenerative elements that will help you improve with either type 1 or type 2 diabetes. So to get the process started today, visit us online at r3stemcell.com/Philippines. Welcome to hear from you on the website. We have live chat and contact form. Or just simply give us a call at USA prefix +1 888-988-0515. We have the most cost-effective stem cell program in the world, and now it's available right in the Philippines for your convenience. Thank you so much for watching.